What?
Part 2. Lisa
2.
Holland. You're still watching this? What? That's crazy. That's crazy. You watching them?
Yeah.
Yeah.
Got my eye on you. I see you out there. I see you hustling.
Yeah.
I see you grinding, trying to learn.
Yeah.
Get it right.
Let's get it.
Well,
Okay.
Let's get it.
Let's get it.
What time did you wake up today? 4 a.m. or 5 a.m.? Which one?
I think Lisa said she woke up at like 3 a.m.
Really?
There you go.
Total fabrication on my part, but she does look like she does.
3 a.m. What time was it? 3 a.m. or 2 a.m.?
That's a little much.
Yeah, and
Lisa Holland is on the show. Dr. Lisa Holland is on the show today. Also featuring guest interviewer Amy D. Platt.
You just said Amy D.
Amy D. Because we didn't contact her to get the official pronunciation of her name, and we're sorry about that. But Amy D is a beast.
Yeah.
So we'll leave it at that. Shout out to East Tennessee State.
ETSU.
ETSU.
Yep, right there in Johnson City.
Yeah, right. A lot of big people have coming out of ETSU, but no one as big as Amy.
No one as big as Amy D.
I can't think of a person.
Nope.
Right?
She recent grad. She's going to be a badass clinician. She's into functional medicine, and I believe she mentioned the Spartan training that she also is into. But yeah,
she's also one of the guest hosts on the Fit Nerd Physio.
Fit Nerd Physios. How
Yeah.
can we forget to plug Fit Nerd Physios? Great blog, great website by Kate Watson and Amy D. You definitely need to go check that out. So this one's about some pain brain. This episode, we get into some hashtag curvy hustle. You know, we learn about how to calm the monkey mind that she talks about. More into spirituality. Boom. Daimir's doing the sign language for you.
Yes, I am.
So this one is definitely a continuation of part 1. How you would assume part 2 is naturally a continuation of part 1. But, you know, we get more into vulnerability. And so, I mean, I re-listened to these episodes, like 2 days ago. And it was a great, worthwhile listen, and I got a lot from it. More so this time, actually re-listening to it, because now I'm on a home health rotation, and I can actually this is my first time interacting with patients and people that you step into somebody's home and you can see kind of the culmination of everything that they've been through that led them to where they're at now. You see whether they're got some hoarding stuff going on, whatever type of home environment that they live in, you automatically get to step into their world and see, all right, I can understand this patient at a better level because I'm in their fucking home. And that's what Dr. Lisa was talking about for most of the show, is looking at somebody more than just their one
that snapshot issue, right?
More than just that one snapshot, more than just that one pain diagnosis. You get to see them and view them as a whole person holistically, and you're bigger than your diagnosis.
Absolutely. Awesome stuff.
Cue the fart jokes.
So this man farting walks into a bar.
Yeah.
And then he says, hey, you know what?
Oh,
sorry.
You gotta.
I thought you had it.
You know what would be good on a day like today?
God, come on. Come on.
You're starting it. You got me all wrapped up and believing in you, and then you just dropping the ball.
I don't know, like, what kind of poop drink there is, like fart drink. Fart drink, like smells you later. It's gonna be cheesy. It's gonna be awful though.
Yeah. And if the duck legs is one thing that we're not, we're not cheesy.
Yeah, I know.
So
very collected,
professional. I mean, that's what we're all about here at Duck Legs.
We wear suits and ties every day.
Daimir, describe the Duck Legs podcast in one word.
Fun.
Ooh, that's good.
That was a good word.
Look, we're that. That's all we are.
We're nothing if we're not fun.
Yeah.
What about you?
And one word. Pointless.
Thanks. Those $500 done.
Time waster. I don't.
Worthless. Shit.
Doomed. Doom now. I mean, that's what we are now.
Yeah.
I don't know, man. Like one thing, it sounds so cliche, but like I want to say unique or intuitive, because that's who I want to be. I want to be not lame. But you hear that so often that you just want to be like, nah.
But I would venture to say that even though you hear it a lot, are people really that? I mean, we've listened to other podcasts or shows, and we're like, they're kind of the same, right? I mean, we are unique in our own way.
Oh yeah.
Yeah. Like we went to when we went to like that we went to God.
Dude, you are really dropping it.
God.
Come on.
What's that day? What's that day called?
What's what?
Was it the Capitol?
Yeah, the Capitol.
The state capitol, yeah.
Yeah, like we went to the state capitol and we were the only ones not in ties, and we're walking around. Everyone else is in suits, and we've got video cameras. Girls come up and they're, "Are you guys famous?"
Yeah. Legislative day. Yeah.
Legislative day.
Yeah. But anyway, hope you enjoy part 2 with Lisa Holland.
I'm not gonna say.
Please enjoy it. It was fun.
Yeah, it was a blast. We learned a lot. Great perspective. Very unique perspective. Thank you, Dr. Lisa, and thank you, Amy.
Broken up music. We like this style.
It's kind of one of those things. It's like the duck. You see a duck in the water, right? The duck looks like it's cool, but the duck's freaking working hard under the water. Wow, working hard. That's how our place is. We look cool, but we're working hard.
So what are you guys working on in terms of becoming the practitioners that you would like to be?
Well, I have my first rotation in March. I'm going to be doing home health, so that'll be fun. That'll be
Awesome.
I like that better. I'm glad I got a home health setting as opposed to like a hospital or SNF, so I can actually, kind of what you're saying, get that view of the whole picture looks like from that client. So we'll see.
Literally see where their environment is.
Yeah.
Yeah.
What about you guys?
Many a home health I've gone into, and I'm like, should I be calling child protection? Because, not because they were doing anything. It was like the grandmother I was going in for like a knee or hip replacement, and she was the babysitter,
Right.
that had to work. And you get definitely put into understanding the whole psychosocial model with the bio. Mm-hmm.
Yeah, I hope I don't see anything too drastic, but
no, but it's good to really see where their pictures are, because sometimes when they come in the clinic, you're just like so focused on their knee and like you got to do these exercises, and then it's like, if I had known that you can actually be taught walking over toddler things, we're going to focus on that.
Yeah, seems a little more functional for you.
Right, get functional, right?
Man, I know Amy's got huge things going on. She's got boards next week, and she's about to set her career on fire moving forward.
Yeah. I'm going into.
Right now I'm actually have already put in a residency application, but it's kind of just been a waiting game, and it probably will be for a little while. But I've thought out a couple places, and it's more about just making a decision on what is the best place for me at this point. So it's more than likely going to be an ortho residency, and then hopefully once I get enough training and I feel competent, then I'm venturing out on my own. But I don't know when that will be. It will be at some point.
Yeah.
But probably within the next 5 years or so. We'll see.
Lots of things can happen, and you don't want to feel like, oh, I didn't do this the date I said, so I'm a failure.
Yeah. No date set in stone. Just at some point. That's down the road.
Right. That sounds good. I always feel like orthopedics and pediatrics. I feel like not enough people go into pediatric rotations, and that's really unfortunate, because if you know I really feel like, honestly, those skills of assessment and functionality and the focus of the way that goes, that really could have been not necessarily just, I don't think you should forget that when you work with older adults. I don't know why we forget that. And it's like everything in the whole way you get from 0 to 1, or at least when you're running, maybe to 3 or 4, is really at the core of whatever you're seeing later on. and movement patterns and things like that. But I don't know if we spend enough time in a lot of people orthopedic. And I'm like, wow, you should have really, if you get an opportunity to take pediatrics, even if you don't want to work with kids. Because let me tell you something, you learn if you're a good therapist or not, if you can somehow get their glute strength up when you can't say, let's do 3 sets of 10 with this machine.
It's challenging, I'll tell you that. And keeping a child entertained for an hour too, that's tough.
Yeah, it's exhausting. But you get an appreciation of that and the sensory, and also, PT and OT in that environment, pretty much the same thing. And that's okay, because the kid gets a double dose of that if they're doing that or whatever, and the application of all of that to speech. And then you get a real understanding of deep core, which a lot of orthopedic people, like, they learn, like, setting up to go sit to stand. I don't even know if you guys learned that, but there was a whole, like, postural sets and that. And then we talk about, like, rehab of the athlete, and we're not talking about the deep core postural set. And we're working on all the, extended leg and arm. And it's like, you're missing that whole, pelvic floor, transverse abdominis, diaphragm.
Mm-hmm.
And then, up at the throat. And so you're missing that whole thing. And half the time, that's why the person's doing this when they're doing their walking. Because you miss that. So peds is where you get that stuff. So don't discount a peds rotation. A lot of experience to be had, even if you don't want to work with kids.
Awesome. That's great insight for me, because I had peds was nowhere near my thinking.
Me neither.
It's hard, but that's why it's hard. It forces you to be really good.
It's also fun to an extent too.
Yeah, you know what it is though? You get a lot out of that. You realize, like, I don't know if this is going to be carried over or whatever at home. You get a lot out of, these kids they're just, you get a nice appreciation about people's pain. I can tell you right now, having done a peds thing where I see somebody who, like, literally had to get manipulated because of, their foot being contorted or whatever, and they're laughing still, and you get a real appreciation of that pain brain and the power, how much person's story about that pain is influencing what's going on. Because the one place, if you go in a kids care place in a kids hospital, I mean, there's not a lot of crying. I mean, you know what I mean? That should tell you something. So, and they're in pain. They're in just as much pain as the adults, and having really scary stuff happen.
So that's society teaching us to cry and be sad about our pain, maybe?
Well, again, very mindfulness. You're going to manifest whatever your mind goes to the most. So if you're only looking at what it is you're fearing, maybe you guys just think, I'm never going to be able to pay my debts, I'm going to have to do this or whatever. If that's all you're constantly thinking of, instead of that practice that's successful or working in an environment where you're contributing, and if that's not on your mind more, you're going to basically manifest to be having exactly what you thought. A debt-induced, lifestyle.
Yeah.
Mind's powerful, guys. It is. I mean, we see it. I hope you guys have seen, and maybe in your own life, like, if somebody comes in depressed, I don't care. Keep doing the dry needling. It's not going to make them. It's not going to make them not have to come. Yeah. And after a while, they're not going to be able to come. And if they're not on board, their mind's like, this dry needle is what I need. That's what makes me feel better. Yeah, alcoholic says the same thing about their alcohol.
Yeah.
That's true.
I remember just from being a tech, before I even got into PT school, you see those patients that just look like they're depressed, and they just look like they'll never get better no matter how many 2 sets of quad sets they do, and you look for that functional medicine or integrative medicine or some other type of model to really get in there and ask questions on a deeper level.
Yeah, and see if they'll answer you. And the funny thing is that's just human nature. I mean, that's as much, I work that same thing, the same, my Mind Body Brand Academy came out of really helping physical pains of health providers after a while, because they get in that psyche too. Oh, I can't do anything, that's insurance. I mean, I've heard people on their first visit be like, well, we're only going to get 8 visits, likely. So we'll do the best we can. And, I mean, okay, so here I am, the scared person with the inability to walk or whatever, and you're like, you're likely not going to get better. How about being that person and be like, we've got 8 visits. Let's see where we can get. You know, that's my son being really annoying. Let me turn off the thing.
Are you good?
You know, let's just see where we can get. Let's see what we can do. We're probably, you know, we're going to have a lot of work. I need to know exactly what the deal is. Do you sleep? What are you eating? You know, whatever. Who do we got to get on this team? And I saw the same thing in starting a practice, right? Somebody said, oh, you did cash base for a long while, or how do you integrate that yoga thing so nicely, or how are you getting people to be on this month thing? Or so we started asking questions, and I was seeing it's the same syndrome. It's the same kind of, I don't know what the word is, but it's a mind game. They just didn't see it another way.
It's that more focusing on the negative aspects?
Negative or just like only that way. Like just not going beyond the conversation. It's not even being positive versus negative, because some people, like, if you're really sick or whatever, they may not want to be positive, but that's my job. If I lose the hope, if I don't have the faith in my ability in 8 visits, then why the hell do I think somebody's going to go pay for it? And that's what I took on and went into my, you know, my branding and having a voice and helping women do that and figure out what it is for their lifestyle to make that, you know, career, whatever, know where they're going. Because if you're going to sell something, if you want to, even if you know, it's just you're in an office and you want people to come to you because you do something special with female athletes or something like that, then you need to, like, own the crud and the good. It's not always going to be positive. It's not, you know, but you need to have a voice for that. You need to have a conversation. I don't know if it's always positive, but it's boss. You know?
Okay.
Sure.
So I know you guys had some questions on, I don't know, you had some questions about maybe how I integrate stuff, or I don't know. Sky's the limit with me. So anyway, any way that I can, you know, I'm curious. Why so was that conversation? What was it about the conversation? Because the logic of that conversation more, or just the fact that somebody said something?
You're talking to me, correct?
Yeah.
Yeah. Okay. I think it had to do with both. Because for a while I have been going with I gotta wake up, I gotta do, and then for someone to be sitting there saying, "Hey, take a step back," and it really made me self-reflect into myself and say, you know what, I have been you know, eating less and, you know, taking 30-minute lunch and doing exactly what the people on the page were saying, and then for someone else to come out who's very successful, I might add, and say, you know what, we don't have to necessarily do it that way. So for me, it was not only the conversation, but the overall message, because the question didn't start with people talking about that. I think the question started, how many hours are you normally working in a week? And people started posting their hours, and people, you know, the hours started getting longer, and people started comparing, well, I only work this hour. And you're like, hey, you know, it doesn't matter if you work, you know, 12 hours or 8 hours, it has to be proficient. Like if you're hungry at 3 o'clock in the afternoon because you had a 2-second lunch, then that's a problem, because it's affecting the patient, it's affecting your overall person. So that's really what made me, you know, look into the conversation and self-reflect and say, if I'm not taking care of myself, if I'm not doing what I'm supposed to be doing, then there's no way I can tell anyone what to do. So
Yeah. It's kind of like owning it.
Right.
But in that way, you don't have to be perfect. 'Cause that's the other flip that sometimes I'm working with people, is they feel like they have to be perfect. That's not it. In fact, if you can be expressing your vulnerability and tell people, I know exactly what you're talking about.
Ask Jared about that week.
Him in 2 months. But I know why. That's the thing you can give them. And then they're like, yeah, and like, how did you do that? Or how we get, or then I say, you know what, you're absolutely correct. If you're telling me you have no web of support, how can we get you a web of support? What do we got to do?
The magic's in the vulnerability, right? You got to be upfront with your concerns and show that vulnerability to have that credibility almost.
We're not perfect because we became doctors of physical therapy. So get over yourself and just, get real. And I think that's a lot of, my guru goddess vibe, my guru goddess tribe. That's the attitude, is there is a curvy hustle. It doesn't just have to be linear.
Okay.
There's a curvy hustle.
Curvy hustle.
And yeah, that's hashtag curvy hustle.
Hashtag curvy hustle.
I said it right here on your podcast.
Whew.
Famous enough. But, that's the feminine vibe, the feminine empowerment, the feminine flow, which, again, is not about body parts. Mm-hmm. You guys just saying that right now, you got it. Mm-hmm. But we need more men who have that. And we definitely need more women who own it. Because we've got your vibe. I know exactly how to get from A to B. I did that very well until I had my burnout. So, like that, it's, I know that. But I need to teach my sons this. And so we can both do what we need as needed. So that if you're feeling ill and you need to be honest with somebody and say, we got to do this another way. I'm feeling you. Stuff's going down in the world. Still gotta get your leg working. We can appreciate that.
Yeah.
And that's where biopsychosocial, where I really feel like that is that more curvier way to get to the end. And I don't know if you've ever seen like those things like Here to Success. That is not necessarily, there's a focus, there's a clarity, and that's kind of like where my calm comes in. There's a very surface. If you go on bellyguru.com, you'll see that there's this like water on the top, and that's the idea of like, this at the surface of us working together. If all I can get you to just calm the monkey mind and figure out that there's something we can do, and we can figure out, that'll be happy. But if we're going to go even deeper under the surface, then we might see some other things. There's a lot of stuff going on underneath the surface. And so, at first maybe that calm stands for clarity and awareness and love and motivation. But if we can go and get a little deeper, then I can start talking about courage and attitude and, letting other people help and, mindfulness as you do it. And then there's another level. So, there's not one thing to that acronym, but it's the idea of, calmer and calmer. And then you start seeing a lot of other things and you start to realize what's under the surface, and you've been only seeing that one tip. So I think definitely as we go in as clinicians, we got to remember that. They're only showing us this body is the outcome of so much of what went on underneath.
Okay, so I have just two, commentaries or questions. Where would one go to begin to have that mindfulness? Now, of course, you can't get in a weekend course. So is it practice make perfect? And if you do decide to go that route, it's something that may not come natural to some people. They might just be so focused on the biomechanics, or they never really express themselves in that manner. So how do one go from, hey, I'm so focused on, treating to going over and say, it's about treating holistic. Now, of course, we're learning in school, but until, the unit starts saying caring and mindfulness, we may not, see that in practice for a while. So how do we shift that route? Or do we have to go cash-based to do it?
How can I get those curves?
Yeah. You can partner up with people like me,
right,
that can show them in you. Because again, we all have these aspects. It's not like I grew a penis to understand the masculine way.
Oh, right.
So you don't have to get a uterus and all of this to understand this way. But you need to be around it. So you need to see leaders.
Gotcha.
You need to maybe start listening to some. One of the things I want to do with my podcast with Owning Her Health is showing people who are doing, women leaders who have, used their vulnerability to develop wealth paths or changes in contributing still with skills and seeing things. I have a health provider index, which is a coaching. One of my coaching assessments is to accelerate, get an objective. It's a coaching tool that I found from, people doing interviews and stuff. So when you go to an interview somewhere, they might give you this type of assessment that lets them know who you are, what are your behaviors, what are your core motivators, do you fit on our team? And I have one. I searched out one that I'm actually developing a certification in the assessment of that. But the first thing I do, and what I put in my Mind Body Brand Academy, and what I do one-on-one when people contact me for mentorship, which could be male or female, but my academy is just for females, is this provider index, because it gives you your behavioral style, your core motivators, and also evaluates them in terms of like what are your main ones and your natural strengths, your communication style in a very, like,
Right.
this is the report. This isn't me subjectively listening to you talk and then giving you my opinion. This is you answering this. It's a, reliability factor we can see. And so I was really happy when I found that, because I saw right away that it could give exactly what you're saying, a self-reflective tool where I would take 2 months on the mat with you and yogic practice. I can get that, and I actually use that when I clinically, to help people see themselves as well. So I have a very specific targeted one for health providers. I use the language that they use, and they can see their role, and then also their own self-view of themselves as a health provider, and also where that's going to fit in the big picture.
Mm-hmm.
But I have one also just as a general behaviors and motivators, their readiness for change. I have another one just because some people are just not ready for change. But instead of me telling them that and then being like, no, that's not it, I'll say, well, it looks like in your readiness for change, you don't really have strong confidence. You do really have really a strong adventurousness. Could you possibly be thinking like the risk in the wrong direction here? Let me weigh this out and see if, I can beat it.
Right.
And then we have that conversation. It's just allowed it to be a much more, self-reflective conversation, because that's what you have to do. That's the skill you need. And then you can see that in others. You can't see it in others until you see it in yourself. This idea that we're going to motivational interview and I'm going to like totally know, oh, well, then now we do this and this and that, is reducing it again. It's the same thing as complaining that total hips, this is what we're going to get, this amount of money, and this is how we're going to do it, and it's all should be done within whatever hour. It's average, but there's a bell curve. We love statistics until we have to talk about the 33 and the 33, right? Then all of a sudden, that doesn't matter.
Again, the curves. It's all about the curves.
It is.
The answers lie in the curves.
It does. I'm telling you, you maybe 23 years down. Medicine has a tendency to know something and get it into action about 20 years later. So in 20 years, these little tidbits will hopefully do something.
We'll still be practicing, so we'll be at the forefront of that. Okay.
Yeah, exactly.
All right, we told you so. We were doing a podcast for 20 years. We told you so.
Ahead of the game, you'll be able to really give solutions.
All right.
From knowing how to, just like me 11 years ago with my little, yoga. There was no yoga therapy in Charlotte Place. There was no cash-based physical therapy office 100% in North Carolina. You understand? I took this New York state of mind I came down with, and I was like, direct access since 85?
Uh-huh.
And,
That's awesome.
I didn't, but that's, risk averse. That was for me. And then hopefully I inspired other people who then went and did that. And also I went and found other people so that us together could be talking on podcasts and things like that. So people say, oh, I didn't even know I was in a book. Dr. Joe Simon has a private practice academy. I was on his podcast, my first podcast in 2013 that I was asked to do. And just recently, I was looking at his book because I was using Medpreneur and I wanted to ask him if that was okay because I knew he was one of the first to use it. And I looked through the book and I didn't even know it was in your book.
Awesome.
I made it.
And I was like, I made it back in 2013. I didn't even know it.
Yeah, that's awesome.
But that's what I say. What is success, right? It's my personal utopia. And after a while, it was talking to you guys, so.
Yeah.
Just remember that. Success is your definition, but you better know what you want and your motivators because you'll be chasing somebody else's dream and you'll get there and you'll be like, I'm not happy. I'm not fulfilled.
Gotcha. Yeah, I'm trying to figure that out myself for sure.
It's okay to not know it now. You're just at the beginning. You have other thoughts, but you're not going to have, it's not in the textbook, guys.
Yeah. I'm beginning to understand that more and more. These so-called textbooks.
I second that, Jared.
Yeah.
Yeah, I second it.
I'm glad. I think all three of us students are former. One is a former student on here. I think we all of us have a dream of one day owning a practice, and I'm glad we have Amy on here as well, because I know I've seen her in some groups talking about owning her own space one day. So I'd like to get her opinions on that, and that we have Dr. Lisa, her stage name, on here as well to maybe lead her through that journey, that curvy journey to owning your own practice one day, and what that feels like.
Yeah, I mean, right now the thought is hopefully opening up a gym that has some type of clinic in it, not the other way around. And that's as far as I've gotten with that. I mean, I got the idea actually because I started doing Spartan training because I did a Spartan race about a year and a half ago, and the gym itself is a Spartan training gym, so it's like an indoor obstacle course playground. And I was like, I want to do that.
Yeah.
and treat people that want to do that. So there's not really a lot of people doing that right now, if any that I know of. So that's kind of where I'm thinking of heading down anyway.
That's really cool. That's kind of the approach I took. I never opened up a PT place. I had PT services at my yogic-centric pregnancy niche wellness studio. And then that grew into just a wellness center and a coaching. Even now I have a coaching office because that's just more of what I wanted to sell. And then it's a really cool coaching office and a really cool wellness center because I can put on the hat as a physical therapist whenever we need to keep doing what we're doing.
Mm-hmm.
So how often do you find yourself treating versus, I guess, coaching? I mean, I know you do a ton of other things, but
that's changed. You know, I stepped away from my wellness center in 2013, just my spiritual journey. But the end of that, I realized I was done with that phase. I really think part of me doing that was to prove to people it could be done. And then once other people started to do it and this and that, it just stopped. It felt like I needed to actually find those other people to support people like you. There's just been a real big shift, even from when my brother's a doctor of physical therapy, South Carolina. He graduated 4 years ago. He didn't come out of school with people doing what you guys are doing. Like, oh my God, there's students and they have a podcast? Who the hell do they think they are? Right?
The duck legs, man.
And then they go out and they actually ask people who are out, established and talking at places. And this was like, I'm not enough. I can't possibly ask. So that's a great shift. But I think it came out of leaders coming out together and supporting each other.
Mm-hmm.
In community for themselves, for growing their own businesses, but in effect making a bigger vibe, a bigger energy, a bigger tribe of that. So when I had my space and whatever, you know, that was, it was pretty fluid. I would assess them and see what level of hands-on they needed, but to be perfectly honest, the minimal I could do and the more I can do functionally has always been my gig. So I would give myself days. Like I'd be like Tuesday, Thursday mornings. I was doing like, cause I'm really hard with switching like per patient or per client. So I'm better being like PT hat on these days or these hours. And then I would teach, like I would teach yoga class on Tuesday, Thursday mornings, 9:30 class and 11 o'clock class on Wednesday and whatever. And that's, you know, and then I might see a private person after that to build on individual things to their ex. But if I was going to go in and do like a pelvic floor assessment or whatever, I'd probably put that on a day where more evaluation or I'm just sort of focused in that world in my head. So it would fluctuate. But in general, again, it comes out to what you feel is successful. I wanted to make breakfast for my kids every day, most of the days. And so my work day, you know, didn't start till about 8:30. If it was really somebody in, you know, membership level, I didn't have membership levels till more towards the end, but, you know, but when it got to that, one of the perks was I would inconvenience myself because you've invested in me. I would go invest in, you know, that day my husband did it or somebody else did it or whatever. I'd see you at 7 before work. Or you'd have the after work hours. But otherwise I was like, 3:30, gotta go, bye. So, you know, maybe I didn't make as much as if I filled it. I could have filled it all up, but to me that was part of my pay. That's one of the reasons why I did all this. I wanted that flexibility. That's how I wanted to be a working mom. So that when I'm working, and I know that they're either getting picked up by somebody else that day or whatever. My brain's there. And then when I was home trying to be that was actually always the harder thing for me because I like work. I like my work. So, that's a hard question for me to answer, Amy, but I will tell you right now that right now my model is $495 the next 30 days, and we work this out, and that's a lot different. If you have 10 people doing that, 10 people, I don't know how much you're going to get. You know what I'm saying? When I was doing per diem, I think I got $40 an hour. So if I was working 2 days, 8 hours, I'd get that. But so I could do that. I can be giving them other things, other ways to get paid. Like when you're saying your thing, I'm like, right away, I'm like, yeah. And then on the weekends when people don't come after 12 o'clock and on Sundays, you can have birthday parties.
Oh, yeah. Yeah.
You know what I'm saying? So it's not always just the people. There's my yoga center, I rented it out to people that needed space that wanted a nice Zen environment to have their own workshops. You know what's that to be my workshop?
And that's just that more outside the box thinking of don't be limited into the PT mindset, right?
It's professional and business owner. Micro practice solutions. That's my gig. You want to learn about that? You can work with me one-on-one or whatever, because that's my thing. I like to keep it smaller. I didn't like having a lot of staff. Mm-hmm. So for me, having three different staff clinics is not my definition of success, because the mind shift that has to happen for that for me is stressing. But I have to know myself.
Yeah.
I don't feel like a less valuable therapist because I do it between 8 and 3. In fact, I feel pretty cool.
Yeah.
Pretty cool that I've done what I've done. I no longer pay from a BMW. I did that for a little while. I was like, this ain't worth it. Okay, my car might not look, but that was a choice. I was like, I really like my Ford Fusion. It gets great mileage, and you know what I mean? But it gives me the leeway to be like, I'll freaking work 2 months in the summer.
Yeah. Shout out to Ford Fusion, who is a sponsor of the show. Now they are. Something I love that you said, Lisa, on some podcasts, again, either Two Nobodies, shout out to Two Nobodies, or Greg's House podcast, was you mentioned exactly what you're saying, not limiting yourself to a 4-wall practice. And if somebody has that mindset of, I'm going to open up a PT practice one day, I'll need to get all this expensive equipment and an altered G and all these TheraBands. But you're like, nah, just make it as simple as possible.
Yeah.
Minimalist.
Definitely. I made that mistake the first time, and then I walked away from it, and I had to get out of a 5-year lease and everything. And then when I went back into it about a year later, it was a room, and I was like, oh my God, you should have totally done this first. But I never saw it. See, that's the reason I am out doing what I do now. Mm-hmm. Nobody saw it. So I couldn't even think it because it didn't exist. I had to share it. But I didn't look at PT places. I looked at fitness places. Mm-hmm. Mm-hmm. I looked at the yoga teachers that were getting $100 an hour to do a private yoga class.
Yeah.
Mm-hmm.
I love how people are like, they won't pay for their whatever to stop, I don't know. Then, maybe you got to go, and they're not always all rich. See, that's the other thing here. No, you just have to have different price points. So maybe you have a $10 pain course online or something. I don't know.
Yeah, that's awesome.
You just have different price points. Get that good.
Mm-hmm. And show them the value of your service, right?
Show them the value. If you don't want to pay them, you still have something that is of value. If you only have one way to skin that cat, then it makes it very scary, this whole economy and the insurance and
reimbursements.
I always thought of myself as the best yoga person you could work with, the best personal training person you could work. But I learned those things. I didn't just think I'm a personal trainer and a yoga teacher because I went to physical therapy school. That's the other mistake people make. I went to physical therapy school, so I'm awesome in personal training. Not if you really don't know any of that stuff.
Yeah.
Because I should know didn't get that in my physical therapy school.
Yes.
Yeah.
Yep.
So unless you're an exercise physiologist as well, you're not an exercise physiologist. So, so we need to understand where, and again, that goes to, what credentials are you going to get? So like my only advice to you guys is kind of think about a little bit more of that. Like what is your vision?
Mm-hmm.
One of the things I do in my thing is we make a vision board. It's a very girly thing, but it works because I know what I'm working towards.
Yeah.
And it's not just letters, because letters look like a lot of different things, where different houses, same letters can look like different houses, different cars, different days at work, different things in your work, different people coming into your office.
Right.
You better know that before you build it.
All the feels coming out now.
Yeah.
All the feels. Man.
Like where do I treat someone? Where do I start practicing first and then start telling everyone I can do it? Practice.
You got to show up.
Right. You got to deliver on the goods.
You can't just keep saying, well, I know that this letter is going to make it, that I definitely show up.
Right.
I see a lot of people not showing up with less letters and with more letters. And there's people with a lot of letters that do show up, and they're usually very successful. But I think the thing to really look at is sort of like how everybody's contributed. It's changed very much, I just said at one point, I can either at this point in the game go develop myself to be another Paris and teach everybody to do the Paris, the Holland technique and be a Holland type of therapist, or I can actually,
Hollandite.
Yeah, I can help people like this, inspire people to utilize what they already have.
Yeah.
And that goes back to the karma thing I was talking about in that other section of, the energy you're bringing. If you honestly just are like, we're doomed, then you are.
Yeah.
Just be doomed. Just live doomed.
I agree. So just to switch it up, and we have a few minutes left on this recording. The question I've been asking for the last few podcasts, you may not have heard this segment yet, but we do have a segment on here called "What is your favorite duck?" So introduced it a few episodes ago. Totally took Jared and them off by surprise. So we would like to know, what is your favorite duck? And we have had some few good ones.
We've had Darkwing Duck, and we've had what else?
Actual duck.
An actual duck.
We didn't even know. Like,
oh God.
From a scientist, by the way. So it was apropos that she actually named a real duck.
Yes. Oh gosh, I would say. You know what? What's coming to me right now is probably just society. It's like that Aflac duck.
An insurance duck?
Yeah, that's what I'm saying. Like he's just like a loudmouth and but he's actually, if you look at kind of the things, he's like, I have a solution for you.
Correct.
But people are like, it's a duck. They're like almost like missing him, and he's so loud and obvious.
Yeah.
I'm kind of like that Aflac duck.
Mm-hmm.
And I like that because he's coming up, he's just like you see him, you hear him, and they're like totally discounting him, and they're like, what do we do? And I'm like,
Aflac.
We were just talking about, there was another feed on the doctors of the student doctors of physical therapy about like the urgent care.
Mm-hmm. Oh yeah, I seen that. Was great.
Awesome.
Yeah, that was great.
Yeah, and we can be in urgent care, and then everybody's like, oh, I hope that we can do that one. I'm like, just go.
Well, practice. Well, like, where does the practice? Like, you can do it. Just go get a contract.
Go show them why they should hire you.
Yeah, like be there for a month and then show them how to do it.
Like unless it's against your thing.
Right.
I'll leave it at that. Right. Go show them how they can work with you.
So we have about it said less than a minute, but really about 2 minutes. Do you have any self plugs? You want to give some Twitter handles and some? If you are a female health entrepreneur, I believe that we have a lot in common to the extent of what needs to be done, and I can have that conversation. That is who I am probably best for. Clinically, of course, connecting the dots. If you're in the Charlotte market and you'd like me to help you, I don't do as much treatment now because I really am enjoying the mentorship and building some of these other ways for people. My Guru Goddess Tribe online, that'll be getting launched
We'll see how the academy kind of starts out and how many people are in that first launch. That's starting the Mind Body Brand Academy, mindbodybrandacademy.com. You can take a look at that. And actually, each of you can go download the Bliss survey. That'll help you guys.
Yeah.
Okay.
The academy right now, so that's in module 1, but I put that out on just that page if you want to look at that. So that's kind of 90-day incubator to get you from fear to fabulous and getting a brand and getting a sale. That's what I'd like you to do if you're ready for it, but you have lifelong thing. And then the Guru Goddess Tribe Online, that's going to be an incubator for women to work on their mind, body, spirit, and purpose and feed into that whole. They actually at the gold level get the Mind Body Brand Academy automatically with that. So it depends if they're working on personal or professional or both. And so that's kind of where I'm at right now.